Hello dear students, in today's episode we will be talking about transverse lie. Transverse lie is when the baby is lying such that the presenting part is the shoulder of the baby. Suppose this is the uterus and we consider it to be the gravid uterus, and if the baby is lying such that the shoulders are the presenting part or the hand is the presenting part, then it is called transverse lie. Now, transverse lie can be with the head on the maternal left or the head in the maternal right. That we can determine by examination, either by examination pelvic grip or by ultrasound. We can determine which side the fetal head and which side the fetal limbs are lying. Now, why transverse lie occurs? What are the causes of transverse lie? What are the risk factors of transverse lie? Remember, normally the head is heavy, so we have cephalic presentations in normal condition. But if the head is not coming down, then there can be causes which can be grouped from outside to inside. So if this is the uterus inside, then beyond the uterus you have the adnexa, and then you have the bony pelvis. This is the bony pelvis, and then the outside world. So, what can be the causes? Number one, if you start from outside, it can be a contracted pelvis. A contracted pelvis, the head has not come down, has been unable to come down. Then there can be any adnexal masses, there can be ovarian mass, there can be fibroid in the lower uterine segment which has pushed and the head has not come down. Then there can be uterine malformations. Uterus can be bicornuate, uterus can be didelphys or anything like that which has prohibited the head to come down. Then there can be problem in the liquor, there can be problem in the baby congenital malformations can be there, like anencephaly or something like that, or there can be oligohydramnios or polyhydramnios. So liquor can be both increased as well as decreased, which will lead to these conditions. Now see, if it is a preterm fetus, and if it is in transverse lie, then nothing has to be done, because the baby keeps on moving, it will keep on circling, and by the time it is 32 or 34 weeks, the head comes down because it is heavy and it becomes cephalic. So you need not to worry if at 20 weeks or 22 weeks the baby is transverse lie. But you have to wait till third trimester, that is 34 to 36 weeks, you have to wait if the transverse lie corrects automatically. But up to 36 weeks, if the transverse lie has not corrected automatically, then at 36 to 37 weeks, when the baby is sufficiently mature, then we will go for an external cephalic version. An external cephalic version will be done. Now, what actually do you mean by external cephalic version? Now, see, external means it will be done externally, means from outside the abdomen. Cephalic version means we will bring the head down, head will be brought down. So, what exactly you do? You ask the mother to evacuate the bladder, take consent, all the prerequisites you will do, and then ask the mother to lie down in supine position. In the supine position, what you will do is, since the fetus is like this, so you will catch hold of the head in one side and the feet in the other side. Then the podalic pole, that is the fetal feet or the buttocks, will be slowly pushed upwards, whereas the head will be gripped and brought downwards. So this will be done. Prior to ECV, you get a non-stress test done or an ultrasound done to look at the fetal status, that fetal NST is reassuring. Okay. After you have done the ECV, external cephalic version, then what you do is place the mother in reverse Trendelenburg position. Reverse Trendelenburg position. What do you mean by reverse Trendelenburg position? Trendelenburg position means mother's head is down and legs are up. So if the bed is made like this, then it is Trendelenburg. So reverse Trendelenburg means mother's head is up and the legs are down. Okay, this is reverse Trendelenburg. So if you place the mother in reverse Trendelenburg position with the legs down, then the fetal head which has been brought down with gravity it will remain below. So, fetal head will remain below by gravity. Okay. So, that is why we will keep the legs down, and at this position we will stabilize for some time. After that, once it is stabilized, then we will again check for fetal heart, we will do a non-stress test or an ultrasound to look for the fetal status is reassuring. If NST is non-reassuring, then we may need to go for urgent caesarean section. If it is reassuring, then you can leave the fetus and you can wait for spontaneous labor till 40 weeks of gestation. But if it fails anyhow, then we will go for elective LSCS at 39 weeks. Elective caesarean without any indication, other indication, obstetric indication is done at 39 weeks. Now, what are the contraindications for ECV? So, contraindications for external cephalic version will be any contraindication for normal vaginal delivery. So, what are the contraindications for normal vaginal delivery? If it is a contracted pelvis, or if there are fibroids in the lower uterine segment which will inhibit the downward movement of the fetus, or there is placenta previa or something like that where normal vaginal delivery is contraindicated, there you will not do external cephalic version. Okay. Or if there is oligohydramnios or previous caesarean section with a scarred uterus, then you will not do external cephalic version. Okay. So, prior to doing external cephalic version, you have to see that all the contraindications are ruled out. Okay. So, this is what we do. But in one case, suppose it is a twin pregnancy and first twin is cephalic which has already delivered, and second twin is transverse. Okay. In this is the only condition where T2 or the second twin is transverse, there we do not do external cephalic version, we do an internal podalic version. What do you mean by internal podalic version? Internal means we will put our hand inside the uterus, podalic means we will catch hold of the legs, and version means the legs will be brought down. So, once the first fetus has come out, okay, let me draw it like this, the first fetus has now come out. So, it is now empty. So, what we will do is at this time the os is open, the external os is open because one fetus has come out. So, take your hand inside the uterus, rupture the membrane, catch hold of the legs because inside the uterus the head slips away. So, head is not able to grip inside the uterus. So, catch hold of the legs, pull them down and deliver the baby as breech. So, you have to deliver by breech. So, this is the only indication of internal podalic version in modern day obstetrics, that the second baby, if it is in transverse lie, do an internal podalic version and bring the baby as breech. So, this is the management of transverse lie. I hope you have understood. If there is hand prolapse or something like that, then you have to go for caesarean section immediately. Thank you so much for watching this video.